Hey guys, welcome to my channel. My name is Shalyn. I'm a nurse practitioner as well as a registered nurse. My background is in emergency medicine as well as same-day outpatient surgery, and I do have a little bit of a background as a pediatric medical assistant as well. At this point in time, I'm certified as a family nurse practitioner, and I work in an emergency department in Oregon. So one of the things about being a nurse or a nurse practitioner is that your family and friends always come to you asking medical questions. And so I like to help answer their questions. The reason why is because as a healthcare practitioner, one of my biggest pet peeves, and I mean biggest pet peeves, that I'm going to let you in on is how poorly within the medical community we educate our patients. And it just seems like so many healthcare professionals are cramped on time, and so they simply spill out a bunch of words and then leave the patient's room. And a lot of times the patient has no clue what in the world they're talking about. The patient feels like, was that provider even speaking the same language that I am? And the simple fact of the matter is, they probably weren't. Most of the medical language is actually based in Latin, so they probably weren't actually speaking the same language as you. The whole purpose of this channel is to help me alleviate the frustration that comes from my personal pet peeve of poor education within the medical field. So I want to use this channel as a means to post videos about different topics that my friends and family and patients have, where we try and take concepts that seem really confusing or really foreign and break them down into a little bit smaller, more digestible bites, so that hopefully instead of sending patients away confused, instead I want to create a culture where people feel empowered to address their own healthcare, to understand and to dig into what their diagnoses really mean and what they can do to improve their healthcare moving forward. So with that being said, the question of the day is, what is hyperprolactinemia? And what does that even mean? And what are the side effects? And how do I know if that's going on in my body? So watch the following video and you'll find out all the answers. If you look here, it talks about the hypothalamus pituitary adrenal axis, also known as the HPA axis. If you're looking at literature, you're going to see that pop up a lot, and that can seem kind of like an intimidating concept until you understand that it really is just what it says it is. So in the brain, I drew this kind of dark spot here. In the center of the brain, there's something called a hypothalamus. And the hypothalamus is a regulatory center where it receives feedback from the body to know what kind of hormones the body needs and to keep the body in balance. So the hypothalamus then talks to the pituitary gland, which is also attached to the brain. And the hypothalamus sends regulatory hormones to the pituitary gland saying, hey, make more of this hormone, or hey, make less of this hormone. And then those hormones that are made in the pituitary gland then go and act on different organs within the body. And as a result, your body has different effects, right? This affects your growth. It affects the development of secondary sex characteristics. It affects your hormones that control your thyroid. So lots of things are controlled by this HPA axis. Now, essentially, we can just say, for ease of learning, that the hypothalamus pituitary adrenal axis is a feedback loop that keeps the endocrine, or the hormones produced inside the body, balanced over time, okay? It's a negative feedback loop. So in the case of my friend who had an elevated prolactin level, how does this HPA axis work? Well, in the hypothalamus, there are receptors that produce something called prolactin releasing hormones. Based on what is received in the receptors, it tells the receptors, hey, we either need more or less prolactin in the body. So the receptors produce prolactin releasing hormone to the pituitary. And when this prolactin reducing hormone, or PRH, binds to the receptors on the pituitary gland produces the hormone prolactin. And then prolactin gets dispersed into the body and predominantly acts on the mammary glands, which is why my friend was lactating, because she had high prolactin levels. And that's exactly what prolactin tells the body to do. Now, once the body gets in a healthy, normally functioning body, when the body gets enough prolactin, then it says, hey brain, we don't need any more, and it shuts off this negative feedback function until the body needs more, and then it ramps production back up. So over here, I covered some things up so it wasn't quite as overwhelming to start with. So what are some things that could cause an elevated prolactin level? So one thing that could cause it is pregnancy, right? Your body is supposed to begin to prepare to lactate. So sometimes when you're pregnant, you can have lactation and nipple discharge even before the baby is born and before you start breastfeeding. That's very normal during pregnancy. Also, if you were to have chest surgery, it could stimulate that area and it could increase prolactin production. Or we could also see increased levels of prolactin with cancers or with nipple stimulation, which breastfeeding would be a prime example of that. Now, there's another thing that can also cause an increase in prolactin levels, and that's what we call a prolactinoma. So a prolactinoma is a type of adenoma. So an adenoma is a tumor. That's what that oma suffix tells us, okay? So it's a type of tumor, and when we're talking about a prolactinoma, we are talking about a group of adenohypophyseal cells. Now, you hear that word and you're like, I'm sorry, back that train up. What? It's literally just a fancy medical word to say growth of the kind of cells that produce prolactin, okay? So it's an overgrowth or a tumor or a mass of cells that produce prolactin. Now, when we say tumor, it doesn't necessarily mean that it's a cancerous tumor. It could literally just be a benign mass of cells. Typically, MRIs can show these adenomas in 1 of 10 cases that are symptomatic, okay? Now, that means in 9 of 10 cases, even though they're symptomatic, you don't actually see the adenoma on the MRI scan because it's too small. So, MRIs are good because they can be diagnostic if it's big enough to be seen, but there is also potential that you could have an adenoma causing an increase in prolactin and not be able to see it on the MRI. Does that make sense? So technically, we would say specificity is high. So if you do an MRI and you see a tumor, there is a high chance you have a tumor. But if the sensitivity is low, so that means that if you don't see it on this, you don't see an adenoma on the scan, there's still a 9 in 10 chance that you could have an adenoma growing, okay? Additionally, clinically apparent tumors, so the number of people that have symptoms, or I guess the number of people that have a tumor that is actually seen on an MRI scan, to kind of give you an idea of how common it is, it's not super common. 18 out of every 100,000 people have an adenoma, right? Some kind of a tumor on the pituitary gland. And that's not even just prolactinomas only, that's any kind of pituitary tumor. Now, when you have a prolactinoma, or you have an excess amount of prolactin for any cause, right? There are 2 kinds of effects. One is called the hormonal effect, and the other is called the mass effect. So I'm just gonna pull up a chair because my knees are killing me because I'm an old lady. So the mass effect basically just says that there is something growing in somewhere in your body that has gotten so big, and by so big, the pituitary gland is so tiny inside of your brain. So if it's a macroadenoma, it means it's larger than 10 millimeters. So if it's larger than 1 centimeter, which really isn't that big in the spectrum of things, but in your brain, it takes up a significant amount of area. It's called a space-occupying lesion. So if it has a mass effect, it means the tumor has grown large enough that it's now pushing on surrounding tissues and causing problems. The mass effects that you could see if you did have a pituitary adenoma would be things like a headache, because it's pushing on the brain tissue and it could be causing an increased intracranial pressure. It could also, the second kind of major mass effect that we see is visual changes, whether that's a double vision or sometimes it's called bilateral hemiopia. So that bilateral means both eyes. Hemiopia means just half of the eye. And literally you can lose vision in, like if you were to look at my eyes, it would be visual loss on the same side of both eyes. The way that the camera mirrors this, that looked really funny. But so you could lose vision on the right side of both of your eyes or the left side of both of your eyes. And the reason would be because that mass, that space-occupying lesion is big enough, it's pushing on what we call the optic chasm, which affects how you see. So those are mass effects, okay? When the space-occupying lesion gets big enough, it literally pushes on the tissues and causes structural issues, okay? Now the hormonal effects are significant, and typically in these cases, you always see the hormonal effects before you see the mass effects, which makes sense, right? Because if it's a mass that's gotten big enough to cause problems, you probably had some symptoms beforehand. So when we talk about some of the hormonal effects, and I'm sorry, this is kind of small. So when your prolactin is off, it can really mess with a lot of the different endocrine systems in your body. And additionally, if there were to be a mass-occupying lesion somewhere in the hypothalamus or the pituitary gland, there's so many hormones regulated by these two areas of the brain that if one area is off, there's potential that it could also mess up other areas of the brain. So some of the main symptoms that we see when somebody has an elevated prolactin is going to be lactation, right? Some sort of drainage from the nipples. We could also see weight gain, and the weight gain is specifically around the central part of the abdomen. It's called like central obesity. And the reason why that is concerning is because fat in that distribution it's actually linked to an increased risk of diabetes. It's also linked to an increased risk of metabolic syndrome, which affects your insulin resistance. It affects cholesterol. And so that's one reason to kind of be concerned. You can also get what's called a moon facies, which is kind of a very rounded face, right? And those are all effects of the elevated prolactin. And truly, if you have hyperprolactinemia, too much prolactin in your blood, it doesn't really matter how much you work out, your body is going to have these effects, right? Because there's too much prolactin. And part of that is when your prolactin is high, it also can decrease your estrogen levels, okay? And the reason why it does that is because hyperprolactinemia, too much prolactin in the blood, can also cause what's called hypogonadism. And people are like, what does that mean? Usually when people think of hypogonadism, they think of a male with small testicles or a small penis. But when we're talking about hypogonadism in this sense, it most typically is a person that developed their normal secondary sexual characteristics on point, but now because there's an alteration in the endocrine system, their gonads aren't working as well. So in a female, those gonads would be the ovaries, right? So if we have hypogonadism, that means those ovaries are now underproducing. And the function of ovaries is to produce estrogen and progesterone, right? And so estrogen and progesterone have major effects in a female's body, right? And if you have a decrease in those, then you also end up with a lot of side effects, right? So by having that decrease in estrogen and progesterone, it can mess up your menstrual cycle, right? It can cause you to even stop having a period altogether, called amenorrhea. It could also cause you to become infertile, right? Not to be able to sustain a pregnancy. It could also cause you to, that decrease in estrogen can cause you to have changes in secondary sexual characteristics, right? So pubic hair patterns may change and regress to a more juvenile or even more of a male pattern than female pattern. Your pubic hair may thin out. You may not have to shave as much on your legs because that's female hair distribution, right? And when the estrogen decreases, those characteristics can decrease. Additionally, if you have a decrease in estrogen, you can even get menopausal type symptoms. So when we talk about menopausal type symptoms, yes, that could very much be hot flashes. It could also, that decrease in estrogen decreases the thickness of the walls of the vulva, so any part of the general area of a female, right? It can cause you to lose some of the elasticity of the vagina, and it can cause vaginal dryness. And all of those things can cause genitourinary pain, so genital pain. It can cause pain with urination, it can cause pain with sex, with OBGYN exams, and that can all be really concerning to a female. And so one thing that you can do for that is you can use some estrogen supplements, especially topical creams in the vaginal area to help reverse some of those symptoms while you're trying to figure out what's going on, what's causing this elevated prolactin level in the blood. Additional side effects that you can get from having too high levels of prolactin, it can also affect your mood, can have decreased ability to focus and concentrate. A lot of people tend to be more sleepy and just not have a lot of energy to do physical activities. A lot of times people will have poor sleep patterns because of it. And it can even lead to increased levels of depression. So there's a lot of things that this extra prolactin can cause beyond just the obvious, like, oh, I have nipple discharge. Let me just see if there's anything that I missed. I think the last two things that I missed. So again, this kind of falls under the menopausal type symptoms. When women go through menopause, their estrogen levels decrease. And estrogen actually helps to keep bone density. So that's why women in particular, when they get older and they're postmenopausal, they tend to have osteoporosis as a diagnosis more often than a young female. And the reason why is because they have less estrogen. So in women that are having problems, and men as well, with excessive levels of prolactin in their blood, it can actually cause them to have osteoporosis at an earlier age because of that loss of estrogen. And the last thing that I wanted to bring up is if you don't have the estrogen, females always have testosterone as well, but the estrogen and progesterone kind of balance it out so that we have a female phenotype as opposed to a male phenotype that is just driven by a higher amount of testosterone. So in the absence of that estrogen, we can get what's called hirsutism, which is male facial hair pattern, essentially. So you can start to get whiskers and a mustache and things like that. So those are some of the many effects that can happen based on excess levels of prolactin, okay? Now, kind of the last little thing that I want to talk about here is what do we do about it? Well, you go see your doctor and you have them work you up, okay? You want them to check a bunch of different hormones, right? You want to check prolactin levels, your follicle stimulating hormone, your adrenocorticotropin releasing hormone, your thyroid hormones. You want to check all of those hormones that are created by the pituitary gland, right? Because if it's affecting one, it could potentially be affecting another. So that's one thing you want to do. You also want to get an MRI, and then usually you get a follow-up MRI at 6 months and 12 months, kind of depending on what your situation is. Again, that would be in consult with your doctor. They would tell you what is best for you. And the purpose of those follow-up MRIs is to see, A, do we have any kind of a space-occupying mass there? And if you do, is it growing in size? And if you don't have it on the initial, can we see one down the road? How do we treat the symptoms, right? So we kind of talked about how you can use a topical estrogen, but that's really just kind of putting a Band-Aid on one of the side effects. Really, the issue at hand is these elevated levels of prolactin. So what we usually do to treat is we give dopamine. And the reason why we give dopamine is, so in this negative feedback loop here in the hypothalamus, there are receptors that from the body, it tells how much prolactin the body has and how much is needed. And if we need more prolactin, then prolactin releasing hormone is released from the hypothalamus, which tells the pituitary gland, make us some more prolactin. However, if the receptors get the message that we have too much prolactin, instead the hypothalamus produces dopamine. And that dopamine tells the pituitary gland, put the brakes on, we have too much, stop it right there. So if there's too much prolactin, the treatment would be to give dopamine. And that would stop the feedback loop telling the pituitary gland, quit making so much dang prolactin. My body has enough. Now the catch to this is, it only works in some cases. The dopamine only works if the prolactinoma or whatever is producing the excess prolactin originates in the hypothalamus, right? Because this is where the rate limiting step happens. If there is a prolactinoma on the pituitary gland, then it's not actually going to help if you give it dopamine. The reason why is because the dopamine limits the step right here in the hypothalamus, not in the pituitary gland. So that's kind of the downside, that dopamine doesn't always work in every single situation. Okay, so that's kind of hyperprolactinemia in a nutshell. P.S. Ways you know I'm a healthcare provider? I'm using a walker as an easel. You're welcome.